right. Hello, everyone. Good morning. Good afternoon, depending on where you are. And it looks like Evelyn's on. Hi, Evelyn. This is great. I'm just going to say hi because we have a really small group. So
There's another.
we'll make this as casual as possible.
We just got Matthew joined us as well.
Oh, good. Good. Hi, Matthew. Thanks for joining us. And feel free, no need to turn on your camera. And I'm not sure if you're able to come off of mute. No problem if you're not. If you do have any questions while we get into the webinar, we're going to kick off the webinar here in just a minute. If you do have any questions while Garrett is presenting, feel free to go ahead and use the chat button in the Teams meeting. It should be along the top toolbar. Or you can also raise your hand, and I believe you're able to come off of mute and ask any questions. So I'll go ahead and introduce myself. I'll go ahead and introduce Garrett, and then we'll jump right into the webinar. And if we have some people join late, then no problem as well. So hi everyone, my name's Aaron LeBeau. I am a senior manager of business development with Dexterra Digital. For those who don't know us or who maybe just got acquainted to us recently, we are a global consulting organization. We have folks here in the United States and in India. And our sole focus is Salesforce consulting, and we are also a Salesforce ISV partner, which stands for Independent Software Vendor. So we actually create and sell our own applications on the Salesforce platform. One of those is DX Health Plus, which we're going to be talking about today, and all about the ability to accelerate patient conversions for your healthcare practices. So we're going to be handing over the controls to Garrett here. Garrett Brucker is our Vice President of Customer Success and leads our DX Health team, DX Health Plus team here at Dexterra. Garrett will be going through a few slides, giving you a really high-level overview of the solution. And then I believe, Garrett, we're going to be doing a short demo as well.
Correct.
And then we'll leave some time at the end, of course, for any questions. We're also, just an FYI, we're also recording this. So we'll have this available to share after the meeting if you want to reference back to it or share it with anyone in your organization. So I believe that's it for me, Garrett. I'll go ahead and hand it over to you.
Thanks, Aaron. Hello, everybody. Appreciate you guys taking a little time today to join us and learn a little bit more about our offering and potentially see how this might be able to help your practice. So I'll go ahead and share my screen. As Aaron said, I got just a couple of slides just to kind of tee things up, and then I'll flip over and show you what you probably really want to see is just a demo of how this looks and works. And then I'll finish up with a couple closing slides as well. So just to kind of skip ahead here, kind of the key thing here, and we refer to elective healthcare, and that's obviously folks that are in the ophthalmology space, in the plastics or cosmetic surgery space, things like that, where you're predominant form of payment, or a major form of payment for you, is cash and not just exclusively insurance. And so that's where this really comes into play. And we now work with, gosh, upwards of 20 different practices in this area. And so these are, and I'm not going to go through all of these, but these are common challenges that we hear from you as we work with these clients around trying to be more efficient, trying to convert more sales, and bring more patients in the door. And so these are, again, kind of the common things or the challenges that we hear, and we really try to address through our solution. hopefully, as you peruse this list, you can pick out at least a couple maybe that might apply to you, if not more. But let me next flip over, and this is just an overview slide of what our solution is. And again, once we look at this, I'll flip over and show it to you. But just to give you a quick summary here, I'll actually start down in this corner here is around for those of you that rely heavily on referrals from doctors, ODs, and whatnot. We have a way to track all of that in Salesforce and report on that, most importantly. Then we also have what we call a 360 view of the patient. So not only do we bring in your appointments and some of the medical information, but as you'll see, we give you a more holistic view of that patient and an opportunity to capture more personal information about them and be able to track your interactions with them through Salesforce. Okay. The whole goal here obviously is to increase revenue through additional sales, efficiencies, and whatnot. And so we've got a single system for you to track all of those leads, prospects, whatever you refer to them, and your efforts to sell them and convert them, all of that in a single place. And we've got some great reporting out of the box for you to look at that and be able to see the results in real time. That gets over here into our reports and dashboards. But as you can see, it's all about that pipeline, the conversions, because we do bring in appointment data from your EHR. We have insights into the surgical aspects and the everything related to those appointments. Integrations, again, I'll jump down here to the EHR. I just touched on that. Our solution does include that to your EHR. And then last thing here is we've got several add-ons, if you will, depending on your business, that we can also integrate for you, be it email, for example, document generation, SMS, your phone system. Those kinds of things are also a possibility with our solution. So with that, I'm going to jump over and actually show it to you. Okay. So this is the home screen within Salesforce. We brand this DX Health. And this is actually a live client environment, ClearVision, up in the Detroit area. And so first thing you see here is on this home screen, we give you a kind of a rolling list of appointments that are here. And this is being fed exactly through the EHR, and you can have this. From here, though, I'm going to jump into showing you the what we call the MD management for the referrals. Okay. So what we do is for those referring practices, we create a record in here, as you can see, for that practice. And then what we do also is down here, we relate the specific doctors, okay, to this practice. And the reason we do that is because we want to track these referrals at both the OD or the doctor level, as well as the practice level, so that, in this case, you can see these folks have several doctors that are referring. And so not only do you want to be able to look at each one of them, but you also want to look at them in total. Okay, so let me show you how that looks. So for example, here, this is the specific doctor. We kind of have basic information here about them, but most importantly is we're tracking their referrals. Okay, and that's what this section here is. And